Okay, confession time. Have you ever wondered if you really need to have that annual well woman exam that we dread every year? Well, Dr. Ignacio Armas from Women's Care Florida joins us to discuss why it's important to have a health assessment. Dr. Armas, welcome to the show, first and foremost. How are you?
I'm doing fine, thank you. How are you?
Well, you probably didn't like a confession there that I just read, because I think when it comes to that yearly visit, a lot of times women do think that they can just skip it, but there's so many things that happen at that visit that's very important, right?
That's correct.
So let's break it down. Of course, we think about a few certain tests, but in that yearly visit, what is all included? What do you like to get out of that yearly visit with your patients?
The most important part of a yearly visit is a complete and thorough medical history, a family history, because that really guides the provider as to what additional testing need to be done. That's very important. The second most important part of a visit is education, educating the patient and counseling the patient on healthy lifestyle, making the proper choices, and staying active.
And Dr. Armas, you were saying that as patients, we should come into this and be prepared in a way. What do you mean by that, and what do women need to keep in mind so that they can be prepared and get the most out of this yearly appointment?
That's correct. So you should prepare for your well woman examination. You should write down questions that you may have for your healthcare provider. You should come prepared with either a notepad or a smartphone to be able to take down recommendations from the healthcare provider.
And of course, we do think of some of those screenings, like for instance, the pap smear, but the pap smear guidelines have changed. They've even changed in my lifetime, and I've been able to talk with my doctor about that. What are the guidelines, and what do you recommend for that screening, along with some of the other tests that we may see?
Well, guidelines change according to studies that are done, and sometimes they could be confusing to the patient, and they could actually create anxiety. The current pap smear guidelines are no pap smears are necessary until age 21, and then from 21 to 65 every 3 years. After 65, or if you've had a hysterectomy, there's no need for a pap smear, unless you have a history of cervical cancer or a high-risk precervical lesion.
Of course, the pap smears may be the one that we all think of first and foremost when we think of that yearly visit. What are some of the other screenings that you're able to provide women?
Well, the well woman examination is so much more than just a pap smear. A pap smear is important, as I just mentioned, for the prevention, early detection of cervical cancer. However, educating the patient, discussing healthy lifestyles, discussing the family history to guide for additional testing, very important. For instance, screening for breast cancer is extremely important. Screening for osteoporosis is important, colorectal cancer, and heart disease.
Which normally, and I'm guilty of this, I don't necessarily think of that when I think of going to the gynecologist. I think of breast cancer and cervical cancer. But you were saying this is some of the conversations that we can start having. For instance, you even brought up the heart and how much heart disease affects women. Those are conversations that can happen right at that yearly visit, right?
Exactly, exactly. Cardiovascular disease is extremely important. Statistics show that twice as many women die of cardiovascular disease in all female cancers combined. So it's huge. And you could prevent problems with your heart. For instance, starting at an early age, I speak with all of my patients, regardless of their age, about healthy lifestyle, diet, and staying active.
Those are important things that sometimes they just go on the back burner when you're thinking it's only about a pap smear at those visits. Well, in closing, I want to get your thoughts. What do you want to tell people out there? Of course, we've kind of talked about the big picture, but what do you want to leave people thinking if they think, you know what, I made it to last year's appointment, I can go ahead and cancel this? What would you say to that patient?
I'd say it's extremely important not to skip that annual examination. Your life may depend on it.
And of course, all of the things that are involved. Thank you so much for coming in and talking about this today. I can tell how important you think this is and how important it is for your patients. And maybe you're at home watching and want more information on everything that we just discussed today. Well, you can go ahead and visit Women's Care Florida at the website that you see on your screen. And again, Doctor, we really appreciate your time today talking about this.